and welcome to our second annual RAAP meeting. We are very pleased to have you here with us today. We have a number of really interesting panels today. We have a lot to report back to you on, and I hope that you'll find that this is not only valuable for your time, but also interactive and informative, so that you can see not only the things that RAAP is working on, but how we are intersecting with many of the policy issues that are affecting the access to therapies for rare patients. So as part of this morning, I would like to thank our sponsors. As you know, we have also not only had support from the community, but also from our life sciences colleagues. And we would like to thank them for their support. First, Gilead as our title sponsor. Thank you to the team there. We would also like to thank our panel sponsors, Orchard, and I'm sorry, my documents, because I was fiddling with everything, are a little bit out of order. But Biogen and Orchard Therapeutics. And thank you to the teams at both of those companies as well for their support, not only of this conference, but throughout the year. And finally, thank you to Sanofi for your support as well. Again, we are appreciative of all these companies and all the support that they give us throughout the year. With that, I'd like to turn to some of my thoughts. And as we prepare for those, I wanted to share again a little bit about my story. I found out on St. Patrick's Day many years ago while I was a freshman in college that my father had just been diagnosed with a very rare cancer. And the phone call was a wake-up call for me because I was just starting out my life. And my father was ending his life. Because within the next few months, he actually passed and left us. And at the time, there were no treatments. There were no real options for his form of rare cancer. And as we as a family dealt with that, we didn't have hope that there would be anything in the near term either. And of course, he was not with us very quickly. And so that set me out on a path moving into not only health policy, but eventually into rare oncology and then rare diseases. And as many of us, we are touched by family members, we are touched by loved ones, we are touched maybe by the disease ourselves. And so rare impacts us, and rare is part of us. It's part of who we are. And I just wanted to take a moment to acknowledge that at the beginning of our workshop, that rare is always with us, and that we can find ways to bring value and bring joy, bring hope into the lives of those we love, or we can, again, struggle and face all the challenges that many of our families face. And I know for many of us, we have decided to be the former, to be proactive and to provide the help and support that many are looking for and need. And so I just wanted to take a moment to acknowledge that. If we could go to the next slide. Katie? So I'd like to kick it off with just a recap of 2021. 2021 has been a year like many of us have never seen before. We continue to be in the middle of an ongoing pandemic. We have seen a very rapid rollout of vaccines. And we've also seen something that we've never seen, at least in our lifetimes, which is our communities, our homes, our states emerging from extended lockdowns, and all the impact that those conditions have had, both from a policy perspective, but also on the lives of patients, families, and in our own homes. We have also seen a transition over the past year between administrations. We have seen a lot of chaotic events around January 6th. We have seen, efforts by policymakers to deal with the impact of both the lockdowns as well as the pandemic through stimulus packages, targeted healthcare packages, et cetera, as well as the vaccine rollout. We've also seen the introduction of legislation that would expand the scope of government through new programs, through expanded programs. And those are things that we explore and are looking at to see how they would impact rare patients. But we've also seen something really important for RAAP, which was the reintroduction of Medicare out-of-pocket caps in Medicare Part D, which is something that, as many of you know, since 2018, when we were formed, that has been very important to the organization. We've seen rare patients struggle in Medicare Part D, not being able to match the out-of-pockets. And so we see therapies that could be effective for them abandoned, and they go to other forms of care where they can afford the out-of-pocket costs. And then, of course, we've seen drug price reforms, and we'll talk about that in a little bit. And those reforms would actually impact across the lines, not only of Medicare Part D, Medicare Part B, but also potentially in expansion proposals that have been proposed this year that would have made those prices available outside of the Medicare program. We also saw MACPAC recommendations to Congress in an attempt to look at accelerated approval products differently and potentially increase the rebates as well as the inflationary penalties on FDA approved products. Of course, then at the state level, many of the states that we work in were in pandemic response mode. The pandemic, again, we saw large-scale close downs of state economies. We saw then the ramp up. We saw the closing and then opening of school systems. And again, a lot of the rippling impact of all of that throughout our lives in 2021. Next slide, please. And through all that, RAAP has continued to be focused on the key areas that we've identified where we can be the most impactful. First is to protect research and development for rare diseases, making sure that we have the right policies in place so that we can get the right therapy to the right patient on time. Ensuring that rare disease representation occurs in all coverage and access decisions, particularly working with the Medicaid programs to make sure that rare patients are impaneled not just as end of decision participants, but as true participants where their voice and their views matter in terms of shaping and designing policy that allow the patients to access the therapy again at the right time. To address the rare disease patient cost sharing burden, again, we just talked about Medicare Part D, and in reality, that is how RAAP first came together as an ad hoc coalition in late 2016 and early 2017, is to work on those out-of-pocket costs and to make sure that all patients in Medicare have access to the therapies that they need. And then proposing innovative solutions to manage high costs. So for example, value-based pricing, performance-based pricing allowing payers to have the flexibility to work directly with manufacturers to put in place innovative 21st century solutions, including potentially reinsurance as an opportunity to develop new risk pools for rare disease patients. And then, of course, to protect and improve timely access to innovative treatment, particularly with policies that delay or deny access to rare disease therapies across payers. And so those are the key core areas where RAAP has continued to remain focused. And if we could go to the next slide, you'll see that not only have we remained focused there, but there are other areas that impact patient access that are very, very important to not only keeping the research and development pipeline moving forward, but also to making sure that those therapies are available in the lives of rare patients. So whether it's newborn screening or making sure that we are helping with working with not only health disparities, but with voices that can make changes to help rare patients in communities that are underserved, such as our partnership that's beginning with the National Black Conference of State Legislatures, to make sure that we have the relationships and the initiatives moving forward that can impact various communities that make up the rare community. Next slide, please. 2021 saw a change at RAAP. As many of you remember, particularly those who have been with RAAP since the earliest days, we have really been a team that's run on very few cylinders. We didn't have very many resources, and it was largely a handful of 3 of us that were trying to make all of this happen. Coming into 2021, for the first time, we've had staff at RAAP. And this has been a wonderful change, particularly as we're looking to deepen our impact at the state level, looking to actually make changes and continue to move forward with access challenges and solutions at the federal level, and then communicating directly with both rare communities as well as with state and local communities about the impact of policy, the impact of some of the solutions, and the importance of getting more involved. So we have now a federal team, a state team, a policy team, as well as a communications and advocacy team that has been able to help us move forward on a number of fronts that you'll hear about not only today, but in the coming weeks as we prepare for legislative sessions in 2022. And I also want to make note that we have a development team, and that Katie, who not only works with many of our colleagues and co-sponsors, but also in putting together these educational programs with the internal RAAP team. Next slide, please. So the question that I was asked as the team was putting together this forum was, what keeps us up at night? And I can think about some of the things that have kept me up at night, particularly through the spring, summer, and into this fall, as we have approached many of these issues. And some of these are very familiar to many of you, is that delays in coverage, state policies, commercial plan policies, ERISA plan policies, all the various policies across the payer segments that delay patient access to therapies that are approved really do keep me up at night. And I think back to some of my own experiences where we did not have therapies when we were dealing with my father's rare cancer. But at this juncture, in the development of the rare disease therapeutic options, we have a pipeline full of hope. And so these delays in coverage really are meaningful delays, and they are things that really separate patients from the therapy that they might need at the right time when they need it. And so this is something that does keep us up at night at RAAP, and that we talk about regularly, and that we've been working to develop the right solutions to be able to move forward and to address those access barriers. Also, we've spent a lot of time, particularly lately, looking at both the Medicare redesign efforts as well as the efforts to implement broader price controls in the United States, and the impact of those price controls on both rare disease innovation and then future rare disease access. Because we know that if we do see disproportionate or disparate impact in the rare disease life sciences community, that will impact the future pipeline. And in fact, many of us have seen the CBO score of some of the proposals and the acknowledgement by the Congressional Budget Office that price controls will impact development, particularly as you move into the future, and the number of products that are not launched then grows. And because of the nature of the rare disease marketplace, we believe that there will be a disproportionate impact in the rare disease community. Next slide, please. So I apologize that Jason Slotnick couldn't make it this morning. He got called into an emergency. But we do have Angela Lively and Jeff Oldham who are on the RAAP team. And I would like to just spend a couple of minutes with them to talk about some of the things that they're concerned about, and some of the things that they've learned through the past year, some of the things that keep them up at night as we think about the efforts around RAAP and some of the areas that we need to be involved in. And so Angela and Jeff, are you both live and on?
Angela Lively is. I'm not sure Jeff.
I see Jeff
is open yet. So
Angie, just
go ahead.
Yeah, let's turn the question over to you. I know you've put some thought into this and would love to hear your perspective.
Absolutely. And as many of the people here gathered today or know about me, is that I'm a rare disease mom as well, right? I'm a RAAP policy advisor, but a rare disease mom, and as it is for so many people, as Mike shared, it is really personal as well as policy. And so, as we start to talk about some of these dynamics, drug pricing and certainly the opportunity to alleviate cost share for patients, that's certainly so important. But what sort of gives me chills and certainly does keep me up at night is that a biologic saved my son's life 8 years ago. And I'm so thankful for that. He remains in for lack of a better term, remission. And again, so very thankful. But in a very ironic twist to it all, I actually worked for the manufacturer that initially commercialized the product that saved his life. That product was really turned out, it was not really effective for the larger commercial patient population that it was originally designed for. And so its fate was really in question. And so fortunately, the manufacturer decided to bring the product to market, although they realized that it was not likely to be all that successful, and they eventually sold the product. But that morning, when our specialist, our hero, came to our hospital room and said that they were going to start Jacob on that therapeutic, I flashed back to those moments where I certainly was not in a decision-making capability, but I did hear about those conversations where the fate of that product was really in question. And so it gives me chills as I think about perhaps some of the threats that may come to rare disease research and development and the potential to bring some of these products to market as industry has to balance priorities. And so that's certainly what keeps me up at night these days, because I do remember that moment where I knew from experience that we were very fortunate that that product was even on the market.
Thank you. Thank you, Angie. Jeff?
Hey, can you guys hear me? See me now? Apologies for that. Yes?
Yes.
Can you hear me? Oh, okay, great. Hey, everybody, Jeff Oldham. Nice to see everyone here today. Thanks for joining us. And Angela, thanks for sharing your story. I don't have a personal story as it pertains to rare disease, and I've been with RAAP almost a year now, and certainly learned a lot and met a lot of fantastic patients and patient advocates along the way. So I'm inspired every day to work as hard as I can to make sure that folks get the therapies that they need. A couple of things that concern me or keep me up at night, if you will, are first and foremost, I think the current sort of federal or national argument around pricing and the politicalization around it is the lack of understanding, I think, amongst the general public of what kind of onerous effect some of these proposals can have on the research and development process, how much it stifles it. I think in sort of a rush to meet a political need that folks have a lack of understanding around that. That's one. More specifically in the rare disease space, something that I'm very committed to is making sure that the patient community is involved in the decision-making process. I think that's one of the things that we're going to push this year or in 2022 in the States. I think that if folks knew that these patients don't have a say-so in what therapies are covered for them, they would be really, really shocked. And then finally, in regards to Medicaid, just the amount of wait time that patients have, I think it's 12 to 18 months after the drug has been approved. Oftentimes, folks have to wait for the therapy to be approved for them. So those are sort of some things that concern me and some things that I'm very committed to correcting. As far as some things I've seen that impressed me, and in one sort of campaign comes to mind, in something I'd like to emulate in 2022 is the movement around the copay accumulators in the States. I think everyone's pretty familiar with that. I'm not sure how many states passed proactive legislation at this point, but it's been a lot. And the patient community and the company community have really come together. They picked great states, and they've really done a tremendous job of passing this legislation to help those with copay assistance. So that's a strategy roadmap that I'd like to emulate in 2022 as much as possible. Thank you.